Hi everyone. Today is a really significant day as it marks the final stage of easing COVID restrictions. When I look back across the past 18 months, I know how far we've all come to reach this point. We've all had to make so many sacrifices in the way we live, such as whom we see and where we go, and many of us have suffered losses along the way. But the sacrifices that we've made, the restrictions that we've all lived through, combined with a very successful rollout of the vaccine, means that we can now move forwards with caution as a society. And I say with caution because, as the Prime Minister warned last week, the pandemic is by no means over. As the restrictions ease, we're expecting rates of infection to increase in our local communities, and this will obviously have an impact on how many COVID patients that we'll have within our hospitals. At the moment, we only have a handful of COVID patients, and whilst this is a really huge improvement compared with earlier in the year, the modelling tells us that we should expect this to rise. So we won't be changing our infection prevention control guidelines, and we'll be continuing to ask all our visitors to wear face coverings to help protect themselves, our patients and our staff. We would also urge people to continue wearing face coverings in any crowded setting in the community, as we believe this has made a huge difference in infection rates. Looking back over the past few months, I've shared many times my pride in my role working here as Chief Executive and my pride in all that my colleagues have achieved. Everyone has had to work differently, adapting swiftly in response to a rapidly changing environment. But one thing that's remained constant has been the compassionate care that we've provided for our patients over this period, often under very difficult circumstances. And this couldn't have been more evident than in my visits last week, when I met with colleagues in our clinical management team at Poole and our clinical site team at the Royal Bournemouth. The individuals working in these areas are truly impressive. They run a 24/7 service all year round, managing the flow of patients through our hospitals and responding to incidents that arise on site. The teams monitor how many patients are coming through the front door. They work closely with colleagues across the hospital and with the ambulance service, helping to manage pressures within our emergency departments and manage flow through the hospital. To do this, they work closely with all our wards and departments, ensuring that we can discharge patients swiftly, therefore creating more beds for those patients who need to come in. These are really busy, pressurised roles, and whenever I visit, I'm humbled by the level of skill and the experience of these staff and their commitment to maintaining the highest standards of patient care. I was really pleased to have the opportunity to meet the teams last week, to thank them for all their hard work, and to hear more about the reality of working for UHD in the midst of this really busy period. And we know that we're going to have a busy summer. With the emphasis on staycations and the fact that we live and work in such a beautiful part of the world, it's clearly wise to plan on seeing a large influx of tourists. We're working with our partners across Dorset to ensure that all our visitors know where best to go for any care that they need while they're here, from using the 111 service to accessing local GP services and pharmacies, or when they really need it, coming to our emergency departments. At the same time, of course, I know that everyone's doing everything possible to tackle the long waiting times for routine care, which have grown so much throughout the pandemic. Many of our teams are working flat out as we take forward our ambitious elective recovery programme. And of course, to do this, we need to make the very best use of all our capacity. So there are ongoing pressures on our site and clinical management teams. Colleagues within our operations department are working really hard to manage this situation, seeking to calculate how many beds we'll need throughout the year across the different specialties. In this way, we can better manage the peaks that we know will be coming. We're also working hard with our partners on initiatives that will help avoid people having to be admitted to hospital, such as the expansion of our same-day emergency care. At the other end of the pathway, we're working with partners to avoid delays for those patients who no longer need acute hospital care. This includes supporting initiatives that allow patients to continue their assessments out in the community rather than in the hospital. In this way, our beds can be kept available for those who are acutely unwell. So today is an important day, but we know there's still a long way to go before this pandemic is truly over. I'd like to take this opportunity to thank all my colleagues once again for all that they've done and for all they're about to do in providing care and treatment for our patients. I couldn't be more grateful and proud. Thank you.